Lymphoma at ASH, there have been a number of very interesting and exciting developments. There is a lymphoma presentation in the plenary session, so that's always very exciting. We've done a lot of work over the years, and there's been a lot of analysis of different subsets of large cell lymphomas, specifically looking at the cell of origin, be it activated B cell phenotype or germinal center phenotype. But more work is being done to drill down and understanding each of these subgroups to a greater degree. And the plenary session, they're showing that there's actually a specific mutation in a protein called BCL10 interacting with MALT1 and driving NF-kappa B upregulation that really may, again, make for a more aggressive phenotype, particularly within the subset of the ABC type of diffuse large B-cell lymphoma. And it may render cells quite resistant to treatment, particularly treatments like BTK inhibitors. So I think biologically, things that we are learning at this ASH meeting. I think there have been a number of clinical results that are proving very interesting. I think one that I'd like to highlight is actually a negative study, but I thought was really useful. We were pretty excited in the past where we saw results with brentuximab vedotin added to a CHOP-like regimen for patients with T-cell lymphoma. Data presented at this ASH will look at romidepsin added to CHOP chemotherapy in a randomized study, and different to what was seen with brentuximab added to a CHOP-like regimen. The addition of romidepsin has not proven to be as effective. So I think, again, we're learning that sometimes what appears to be a good strategy isn't necessarily always one. And then finally, I think there are a number of new agents that we're learning more and more about. And I think these kind of fall into a variety of different groupings, if you like. We're learning about antibody-drug conjugates and some of the newer ones, and CAM-ET is one that specifically comes to mind in Hodgkin lymphoma. We're learning a lot about bispecific antibodies and data on updates related to that. There's the odronextamab, which is a CD20, CD3 bispecific antibody with a very high response rate in post large cell lymphoma relapses. And I think that's really exciting. And those agents are also useful even in patients that fail CAR T-cell therapy. So I think, again, that's an area of significant promise as one looks to the future. And so I think all told, it's actually very interesting as these new agents are now being tested in relapsed patients to see if we can move that up front with the hope that we'll actually see in combination with more frontline treatment if the outcomes of patients overall will improve.